Hi, my name is Dr. Tori Hudson. I'm a member of Pharmaca's Integrative Health Advisory Board, and I'm a naturopathic physician, been in practice for 28 years, practicing women's health. And today I want to talk to you a little bit about sexual vitality, which is a delicate topic, and certainly one that's best when it's really individualized. But it's a very important topic, and I think sometimes women are hesitant to talk to their doctors about this topic. So I'm happy to share a little snippet of information. First thing I want to say is that our libido, our desire, our arousal, our response, our orgasm intensity, those are affected by many things, from vaginal dryness to medication, chronic pain, hormonal states, our mood, depression, anxiety. Of course, our relationship, if we're sexually active with another, the intimacy that's in the relationship that fosters desire. I can't just say how important enough all these other things are. So don't think of it as just, oh, I'm menopausal and it's hormonal, because it may or may not be that. It may be one of these other things, and I even just shared the short list. One of the simplest things, though, in a menopausal woman is as that tissue becomes thinner and drier, then sexual activity can become uncomfortable, especially touch and penetration. So that's the first thing we look at, is if we've ruled out these other things like medications and healthcare problems and relationship issues, and we're just left with, oh, vaginal dryness and low libido. Well, if it hurts to have sex, then one tends to not want to have sex, and the brain kind of turns off and doesn't want to go there if it's going to be painful. So we can fix vaginal dryness, we can fix vaginal discomfort, we can fix pain with sexual activity. And there are some over-the-counter items, even conventional items like Replens is one of them. It's a moisturizer. There are natural ingredient moisturizers as well in the store. So from a more pharmaceutical moisturizer to a more natural ingredient moisturizer, these things just help with comfort, but they don't tend to have a very curative effect on that tissue. And that's where we have to get into prescription vaginal estrogens. And you have to have a prescription from your doctor to do that. There are lots of different kinds, from synthetic estrogens to natural estrogens and creams and suppositories, all kinds of variety. But this is sort of like one of those magic medicines for vaginal dryness and vaginal discomfort that affects not only those sensations, but just the desire to have sex. In terms of the desire, the libido, when this is a hormonally related problem related to perimenopause and menopause, we have a limited number of options in all of medicine, whether it's herbal medicine or conventional medicine. With conventional medicine, some women, but I can't say all women by any means, will have improvement of their libido with some estrogen and testosterone. Those are the two hormones that most affect a woman's libido. There is a third, which is an over-the-counter hormone called DHEA, which might also help some women. In terms of herbal medicine, we have a lot of traditional herbal folklore here around herbal medicine and libido, and I wish it worked more often than it seems to. But some of the things in traditional herbal medicine for libido have been dong quai, Mexican wild yam, tribulus, damiana, maca. These are the herbs that you kind of often hear about for libido. There is a little bit of research on the plant maca for libido, actually showing some evidence of improving libido. And so that's the one plant extract in a nice, high quality, high concentrated formula that I would kind of look to first. And then you'll see some combination products in the store that have more of these. They often have maca and these other traditional herbs as well. There's even a nifty little item. It's a DHEA suppository. It has to be compounded, and most of the pharmaca stores are compounding pharmacies, and they You do have to have a doctor's prescription, but it's this same little hormone, DHEA, in a suppository that's inserted in the vagina. And there were a couple really nice studies on this exact product, not only improving vaginal dryness and local issues, but actually improving libido. So that made a big impression on me when I read that research. So sexual vitality, look for some of these other underlying causes. Talk to a practitioner that you can really talk to about it. Consider all the possibilities, and then if we're left with hormonal related issues, the things I've talked about today are the ones that are most relevant. I hope that helps you.